So I welcome you all. Today we'll discuss about the suspension. Now basically the learning outcomes or learning objectives under suspension. So first of all, we'll discuss the definition of suspension. Then we'll discuss the ideal properties of suspension, advantages and disadvantages of suspension. Next, we'll discuss how to classify the suspension, that is classification of suspension, formulation of suspension, and once you have formulated the suspension, how to maintain the stability of suspension. So in suspension chapter, basically, you should understand these are the learning outcomes or these are the learning objectives. Now we'll see what is the definition of suspension. So basically, as you know that there are two types of liquid preparations or two types of liquid dosage forms, that is monophasic liquid dosage form and biphasic liquid dosage form. So monophasic liquid dosage form or monophasic liquid preparation, the name itself indicate monophasic means there is a single phase or they are homogeneous preparations. Whereas biphasic liquid preparations, biphasic means there are two phases or these are the heterogeneous liquid preparations. So suspensions are basically heterogeneous biphasic liquid preparations which contains finally divided solid drug particles which are dispersed or suspended throughout the liquid or semi-solid vehicle. Means suspensions are basically the liquid preparations in which the solid is to be dispersed in the liquid. Now biphasic liquid dosage form, as we discussed, there are two types of phases. So one phase may be solid, another phase may be liquid, or both the phases should be liquid. So in case of suspension, one phase is your solid, whereas another phase is liquid. Now whatever the solid phase is, that is considered as dispersed phase, whereas your liquid, it is considered as dispersion medium, or solid you can consider it is as internal phase, and the liquid it is considered as external phase. Okay, so in suspension basically the internal phase is solid, whereas external phase is liquid. Then what are the ideal properties of suspension? So when you have formulated your suspension, so how your suspension should be? So very first ideal property of suspension is the solid drug particle should not sediment, or still when the solid drug particle, if they are sedimented, the sediment should immediately get redispersed. Means now we have said that suspension, it is a mixture of solid and liquid. So when you suppose formulated your suspension, when you keep your suspension, say for example for 10 minutes, okay, so whatever the solid particles, they sediment or they get settled at the bottom. So your ideal suspension should be such that we should avoid the sedimentation or we should avoid the settling of those solid particles. Still, if your solid particles get sedimented, if your solid particles get settled, the ideal suspension should be such that the sediment should be immediately redispersed on shaking the container. So that is the most important ideal property of suspension. The particles should not sediment to form cake. So whatever the solid particles are there in your suspension, if those solid particles, if they form the sediment or if they form the cake, or if they are settled at the bottom, but very important thing is that they should not form a hard cake. So again, on shaking the container, the particles should again redispersed into your formulation. The suspension should be viscous enough to allow its easy pouring. So whatever your ideal suspension is, that ideal suspension should not be too viscous, so that you can easily remove your suspension, you can easily pour your suspension from your container. The suspension should be chemically stable. That is again the ideal property. Whatever the suspension we are making, it should be stable. The suspension would be palatable for oral administration, so it can be easily administered by oral route, whereas for external application, they should not contain gritty particle. Now say for example, in case of calamine lotion, it is an topical preparation. It is a type of suspension only. So if your suspension, if your calamine lotion contains gritty particles, so you will observe that after it application on the surface of skin. So your suspension should be such that it should not have any gritty particles. Then what are the advantages of suspension? So first advantage, it is easy to formulate the drugs having large doses in the form of suspension than solid dosage forms like tablets and capsule. So if the drug is having higher dose, say for example, if your drug is having 750 mg of dose, if your drug is having 1000 mg of dose, okay, so you cannot formulate those kinds of drugs having large doses in the solid dosage form like tablets and capsule. But as suspension, it is liquid dosage form, so you can easily mix your drug, you can easily add your drug into the liquid dosage form like suspension, still if it is having higher dose or large dose. The second advantage, it is easy to swallow for children and geriatric patients. So of course, as it is a liquid dosage form, so as compared to solid dosage form like tablet and capsule, suspension can be easily swallowed by children as well as geriatric patient. The third advantage, bioavailability is greater. Now, as suspension, these are liquid dosage form. Now, liquid dosage form means your drug gets easily dissolved in whatever the dispersion medium you are having. Mostly water is used as vehicle. So, of course, it is in the liquid dosage form. So, ultimately, as it is a solution type of dosage form or liquid preparation, it results in increase in bioavailability of your drug as compared to solid dosage form. Then the next advantage is insoluble drugs can be formulated in the form of liquid dosage form. So it may be suspension, it may be emulsion. Now, if your drug is insoluble, we cannot go for the preparation of tablets. As your drug is not going to solubilize into whatever the solvent we are using for formulation of tablet. So as your drug is not entrapped, or we can say as your drug is not soluble, so whatever the tablet dosage form that we are formulating, or it is difficult to formulate that tablet dosage form when your drug is in insoluble form. But what is suspension? What we had said, that suspension means it is dispersed system. Your drug is not completely soluble in whatever the dispersion medium you are using, but your drug should be dispersed in that whatever the dispersion medium or whatever the solvent which we are using. Means if your drug is insoluble, that drug may be available in the dispersed state. So whether your drug is soluble, whether your drug is insoluble, we can go for formulation of suspension. That is the most important advantage of suspension. Now, what are the limitations of suspension? So accuracy of dosage is less reliable. Now, as we know that in case of tablet and capsule, suppose we take an example of tablet. So as a unit dosage form, the accuracy of dose is there in case of tablet, whereas in case of suspension, as it is a liquid dosage form, so there are chances of what we can say losing of dose. So therefore we said that the limitation of suspension is it is less accurate or less reliable dosage form in case of accuracy. Then the dispersed drug particle may absorb added flavors as it is a liquid dosage form. So whatever your particles are there, those particles are not in the solubilized state, they are in the dispersed state. So sometimes they may absorb the flavors, colors as well as preservative, so which makes it difficult to formulate a suspension. The rate of absorption is slower than the solution dosage form. Now, solution dosage form means what? It is a homogeneous mixture. Your solute is completely dissolved in solvent. That we can call it as solution. Whereas in case of suspension, your solute or your solid, it is in the dispersed form. That's why the rate of absorption is slower in suspension as compared to solution dosage form. Then the next your learning outcome is classification of suspension. So there are different classes of suspension according to what we can say various categories. So first is suspensions are classified according to route of administration. So there are different types of suspension, like suspensions for oral use, suspensions for topical use. Now let's start with suspensions for oral use. So these are administered by oral route, of course, and are convenient for pediatric and geriatric patient who have difficulty in swallowing solid dosage form. So the patient who are having difficulty in swallowing the tablet and capsule, we can go for the suspension. The formulation of oral suspension contains sweetening and flavoring agent to enhance their palatability. So you can use sweetening agent, you can use flavoring agent to increase the palatability of your formulation, as well as to increase the acceptability of your preparation. And basically, the suspensions for oral use are also called as mixture. For example, magnesium trisilicate mixture. It is an example of suspension which is to be administered by oral route. The second class of suspension according to route of administration is suspension for topical use. So these suspensions are meant for external application and applied on skin without rubbing. So topical use means, of course, these are to be applied on the surface of skin. So these are to be used for external application, and these are applied on the skin without rubbing, and they are also called as lotion. So example is calamine lotion. Then suspensions for the ophthalmic use. So suspensions for ophthalmic use means suspension which are to be inserted into the eye. So the drugs that are insoluble or unstable in water are formulated as suspensions for ophthalmic use. Now, say for example, water insoluble drug or the drugs which are unstable in water, means if that drug undergoes hydrolysis, so you can formulate such a kind of drug in the form of suspensions which are used for ophthalmic purpose. Now, as these suspensions are to be inserted into your eye, so very important thing for this suspension is that, or very important characteristic for this suspension is that they should be sterile, they should be isotonic, means whatever the pH of your formulation, it should be compatible with pH of your eye, as well as it have suitable viscosity for retaining your preparation into the eye. So if your suspension is having less viscosity, so it will easily drain out from your eye. So to sustain your formulation, to retain your formulation into the eye, it should have higher viscosity or suitable viscosity. Example, prednisolone acetate ophthalmic suspension. Next class of suspension according to route of administration is suspensions for parenteral use. So parenteral suspensions are formulated to provide the prolonged release. Parenteral means what we can say, we have to use this suspension by intravenous route. Now, the particle size of suspended drug should be such that it can easily pass through the needle of the syringe. Now, we have discussed in case of the definition of suspension that these are liquid dosage form in which solid is dispersed in liquid, and whatever the solid particles which we are dispersing in liquid, the size of those solid particles should be within 0.5 to 3 micron. So if your size of your particle is more than 3 micron, so in case of parenteral suspension, they may block the syringe of your or they may block the needle of your syringe. So you have to maintain the size of your particle, and this suspension should be sterile. Now next, the suspension next classification is on the basis of particle size of dispersed phase. So on the basis of particle size of dispersed phase, suspensions are classified as colloidal suspension and coarse suspension. So colloidal suspension means these are the suspension having the particle size between 1 nanometer to 500 nanometer. And these are therapeutically more effective than the coarse suspension. So colloidal suspension means they have less particle size as compared to coarse suspension, that is from 1 nanometer to 500 nanometer. Whereas name itself indicate coarse suspension means they have the particle size more than 1 micron. Then the third classification of suspension is the classification of suspension according to the properties of dispersed solid. So according to properties of dispersed solid, there are 4 types of suspension, that is suspension containing diffusible solid, the first type. Now diffusible solid, say for example, many insoluble powders are light and easily wettable. They readily mixed with water and on shaking diffuse evenly through liquid for sufficiently long time. enough to ensure uniform withdrawal of each dose. Such substances are known as diffusible or dispersible solid. Now, suspension containing diffusible solid means whatever the solid particles are there in the suspension, they are easily weighted by the liquid. Those particles are called as diffusible particles. Means these particles will be easily mixed with the water or whatever the solvent which we are using. For example, light kaolin, light magnesium carbonate. Then the second, indiffusible solid. Now, indiffusible solid means the solid particles which will not get easily, what we can say, weighted by the liquid, or they will not react with the water immediately. For example, aspirin and chalk. Then poorly weightable solid. So poorly weightable solid means again some substances which are insoluble in water and have poor weightability with water. Means of course they have poor weightability, so they will not get dissolved in the suspension. The next is suspension containing precipitate forming liquid. So many times what will happen, some of the liquid preparations, they contains the resinous matter that precipitates out when added to water. Means say for example, suspension, in case of suspension, if your solid, whatever which we are using, it is in the resinous form. So what will happen, instead of wetting with the water, instead of mixing with the water, that will form the precipitate. So that is again another type of solids which are there in the suspension. The next classification is suspension can be classified based on the properties of dispersed phase into two main types, that is flocculated suspension, deflocculated suspension. So flocculated suspension, as we have discussed, in case of suspension, whatever the solid particles are there, those solid particles settle at the bottom. Okay, now after settling, when we shake the container, those solid particles will again redisperse. So that suspensions are basically called as flocculated suspension. So whatever the solid particles are there, they will form loose aggregate. So on shaking the container, the particles will redisperse again. That is nothing but the flocculated suspension. Whereas in case of deflocculated suspension, whatever the settled particle or whatever the sedimented particles are there, those sedimented particle or those settled particle, they will not redispersed on shaking the container, means they will not form the loose aggregate, they will form hard cake. So that is nothing but deflocculated suspension. So very important point is flocculated and deflocculated suspension. So we have seen in case of flocculated suspension, the particles form loose aggregate, whereas in deflocculated suspension, they will form hard aggregate. Then in case of the flocculated suspension, so rate of sedimentation we can say is high, whereas in case of deflocculated suspension, rate of sedimentation is slow. In case of a flocculated suspension, the suspension shows a clear supernatant, whereas in case of deflocculated suspension, the supernatant liquid is cloudy. Then the next part is formulation of suspension. So formulation of suspension means what types of ingredient or what are the excipients which we are used for formulation of suspension. So very first ingredient is drug. As we had discussed, drug should be in insoluble form in the vehicle, because we have said that when your drug is in insoluble form, you can go for suspension instead of solid dosage form like tablets and capsule. It should have fine particle size 0.5 to 3 micron and uniform particle size distribution. The drug should be present in only one polymorphic form, because different polymorphic form have different solubility. Of course, if your drug is present in more than one polymorphic form, so all the polymorphic form, they have different solubilities, so your drug should be present in only one polymorphic form. Then the next formulation ingredient or excipient used in suspension is wetting agent. So as we had discussed, suspension, it is a mixture of solid and liquid. So if you want the final formulation or final suspension, very important is whatever the solid which we are adding into the liquid, that solid should be wetted by the liquid. Okay, so for that wetting purpose, we need to add wetting agent. So these wetting agents are basically responsible to ensure the adequate wetting The adsorbed air should be displaced from the surface of drug. This is achieved by use of wetting agent. Now, these are the three types of wetting agent, like surface active agent, or we can call those as surfactant, hydrophilic colloids, and solvent. So, surface active agents are also used as wetting agent. For example, twins and span, hydrophilic colloid like acacia and bentonite, as these are hydrophilic colloid. Hydrophilic means they will easily react with the water. So, your drug is going to be mixed into the water at higher rate. And sometimes solvent like alcohol and glycerol, they are also used as a wetting agent. Then the third ingredient used in suspension, suspending agent, thickening agent, or viscosity modifier. Very important ingredient which is used in suspension. Now, suspending agent, it is basically used to stabilize your suspension. As we know that these are biphasic liquid dosage form, there are two phases, so there are chances of separation of two phases, or there, in case of suspension, there are chances of sedimentation settling. So to maintain the stability of your suspension, to increase the viscosity of your preparation or suspension, we are adding suspending agent as well as thickening agent or viscosity modifier. So there are different classes of suspending agents. So these are some of the examples of natural suspending agent like acacia, tragacan. So acacia, it is basically sticky, so it cannot be used alone. So it is always to be used in combination with tragacan, starch, and sucrose. Next is tragacan. It forms a viscous solution or gel with water. It can be used for both internal as well as external product, as they are less sticky than acacia. And it is susceptible to microbial growth, and hence preservative is required. Then compound tragacan powder. So it is a mixture of powder acacia, tragacan, starch, and sucrose. It is used in quantities of 2 gram per 100 ml of mixture. Then sodium alginate is also one of the suspending agent. So it is a sodium salt of alginic acid obtained from seaweed laminaria. It forms a viscous colloidal solution with water, which must not be heated above 60 degrees Celsius, as this results in loss in viscosity. So basically you have to make the solution of sodium alginate in water, and then you have to use that mixture of sodium alginate in water as a suspending agent or viscosity modifier. So you should not have to heat this mixture above 60 degrees Celsius. Otherwise it results in loss in viscosity. Now next class is semi-synthetic suspending agent. So it includes the methyl cellulose, sodium carboxymethyl cellulose. Methyl cellulose, if we see, it is soluble in cold water but insoluble in hot water. Whereas sodium carboxymethyl cellulose, it is soluble in both cold water as well as hot water. And this sodium CMC, it is used in concentration of 0.25 to 1% as a suspending agent. Then microcrystalline cellulose. So at low concentration, it disperses in water, forming a colloidal dispersion. While in high concentration, it produces a thixotropic gel. Means MCC, that is microcrystalline cellulose, if we are using it in the low concentration, it disperses in water, forming a dispersion like suspension. Whereas if we are using it in the higher concentration, it forms a gel. Then some inorganic agents are also used as suspending agent. So under inorganic agent, the very first type is clays. So there are different types of clays like bentonite. It is a type of suspending agent only. So very important is its concentration. So bentonite in 2% concentration is used as suspending agent. Then next is hectorite. So it is white powder and it absorbs about 14 times its own volume of water. So it is used as a suspending agent for external application. Then Vigum, so it is again nothing but the suspending agent, and chemically it is called as colloidal aluminum magnesium silicate. Then aluminum hydroxide, it is also the suspending agent, or it can also be used as wetting agent for substances which are not readily miscible with the water. Then the next type of suspending agent is synthetic suspending agent. So synthetic suspending agent means carbopol. So carbopol, these are basically the copolymers of acrylic acid and allyl sucrose, which are again available in different viscosity grade. So it gels in water at concentration of less than 1%. So basically carbopol, these are used as viscosity modifier, or we can say viscosity enhancing agent, because less than 1% concentration if we have added in water, it forms a gel. Then colloidal silicon dioxide. So it is also being used as a suspending agent, as well as it is also being used as a viscosity modifier in concentration of 1.5 to 4%. Then after suspending agent, the next one is flocculating agent. So very important, we have already discussed flocculated suspension means what? Whatever the solid particles are there, they will form loose aggregate, so that your suspension will be easily redispersed on shaking the container. So therefore, to form the flocculated suspension, we need flocculating agent. So flocculating agents are being classified as some electrolytes are there, some surfactants are there, as well as some hydrophilic polymers are there. Now, in case of electrolyte, the examples are sodium acetate, sodium citrate, surfactant like non-ionic surfactant, your twin span, as well as hydrophilic polymer, the example starch, glycerin, cellulose derivatives, tragacan, carbomer, all are used as flocculating agent. Now, after flocculating agent, the next ingredient which is used in the formulation of suspension is vehicle. So vehicle means, as we know that mostly the water is considered as vehicle of choice for the formulation of suspension, and along with the water, many a time syrup or glycerin, they are also used as the vehicle in the preparation of suspension. Now after that, the next ingredient is preservative. As we are using water as a vehicle in the preparation of suspension, so of course there are chances of microbial contamination, and many of the suspending agent or ingredient which we have discussed are susceptible to microbial growth. So to avoid that microbial contamination, we need to add preservative in your formulation. So these are some of the example: benzoic acid, chlorbutanol, and sodium benzoate. Now, coloring agent, flavoring agent, as we have discussed, to increase the palatability, to increase the aesthetic value or acceptance of your preparation, we have to add coloring agent as well as flavoring agent. Then sweetening agent. So again, they are added to improve the palatability of preparation, like sucrose, sorbitol, and mannitol. Then some artificial sweeteners also we can use, like saccharin as well as aspartame. And synthetic sweeteners such as sodium saccharin can affect the degree of flocculation. So the synthetic sweeteners are being used less wide. So this is about the formulation of suspension, and the next learning outcome is stability of suspension. So now once we have formulated the suspension by using different ingredient, the next is stability of suspension. So what is mean by physically stable suspension? So as we have discussed, physically stable suspension means it should be readily redispersed on shaking of container, and the particle size should be constant throughout the shelf life of suspension. Again, it should be poured readily and evenly from its container. So physical stability of suspension will depend on many factors like nature of dispersed phase, dispersion medium, the additives used in the suspension, and rate of settling of particles as described by Stokes' law. So basically, the stability of suspension is described by this Stokes equation, that is V or dx by dt is equal to d into bracket rho s minus rho p into g upon 18 eta. Now what is V? So that is your velocity or rate of settling. Now from this equation we can say that suppose d is your diameter of particle, so velocity or rate of settling is directly proportional to diameter of particle. Means suppose if you want to reduce the rate of settling, your diameter, accordingly you have to adjust the diameter. Then rho s minus rho p, again it is density of particle and density of medium. So again, greater the rate of settling, when there is greater rate of settling, when the rate of this density difference is more. So if you need to reduce the rate of settling, you have to reduce this difference between the densities. Then g is what? It is acceleration due to gravity, and very important, eta is the viscosity of medium. So as viscosity increases, the rate of settling decreases. So therefore, one of the ingredient in the formulation of suspension is viscosity modifier. So we need to increase the viscosity of suspension, so rate of settling decreases. So from the equation, what are the factors affecting stability of suspension? Those are the factor only that we had discussed in the Stokes law, that is diameter of dispersed particle. As we have seen here, diameter is directly proportional to velocity or rate of settling. So if you reduce, or if you want to reduce the rate of settling, you have to reduce the diameter of particle. So that is your first factor. Then difference between the density of dispersed particle and dispersion medium. So again, the rate of settling is directly proportional to difference. So if you reduce the difference between the density, ultimately the rate of settling decreases. And the very important third factor affecting the stability of suspension is viscosity of dispersion medium. So rate of settling, as we have seen in the equation, dx by dt is inversely proportional to viscosity of medium. So as the rate of a settling increases, viscosity decreases, or as viscosity increases, rate of settling decreases. Understood? So in today's lecture, we had discussed about the suspension, its definition, advantage, disadvantage, ideal properties of suspension, classification of suspension, what are the different additives used in the preparation of suspension, and once you have prepared the suspension, how you should maintain the stability, what factors you should consider for maintaining the stability of suspension. Thank you.